夠鐘。
Good afternoon. We had a quorum at the appointed time. Well, today the venue is rather special. That we have the usual meeting room partitioned into two, and we invite the administration into the room, please. Today we have two items on the agenda. First, we talk about the gerontechnology, and second, we talk about provision of healthcare vouchers for persons with disabilities. So last time, we discussed the impact of the pandemic to those with long-term hearing needs. After the meeting, if you notice, and the day right after the meeting, we have a double suicide by this Pwd and her carer. So for a mother who cared someone with a long-term condition, and this feeling of trappedness and lack of support is more acute during the epidemic. For us to discuss these subjects, the need is demonstrated in our society. We hope that such key livelihood issues will continue to stay within the public eye. First, we'll talk about the application of gerontechnology. First, can we have administration to walk us through the paper, and I'll open the floor to questions. Assistant Director Mr. Kwok Chi Leung, allow me to make a simple introduction. When we talk about gerontechnology, we'll talk about in the Innovation and Technology Fund for the application of elderly and rehab care was announced in the policy address in 2018 to earmark $1 billion and formally launched in 2018. That all the subvented services and all the elderly rehabilitation service units, as well as the day rehabilitation and community support services units, are eligible. There are about 1,500 of such units eligible for this IT fund. The key objective of this fund is help it to enhance the living quality of the patients, elderly and the carers, and also reduce the pressure faced by the staff. So here are the key goals of this fund, and through this fund, the applicant organization and the service unit can procure some products or equipment or tools, and also they can loan or try this technology products. Besides the hardware, we also allow the mobile apps and the software that can be get the funding through this fund, and also appointed the HKCSS for two areas. First, on to promote the use of technologies among social welfare institutions, as well as to provide a platform for social welfare institutions to share experiences. On the other hand, they also set up an expert assessment panel that in terms of elderly services and which kind of IT can mature enough to be applied in our service units. And another expert panel will also vet these applications, and also to come up with this reference checklist of recognized technology application products in the SWD and HKCS website. And the HKCSS have also uploaded their past findings on their website. And all the applications being vetted by the expert will get to the assessment panel for a final decision in approving these applications. And our assessment panel will come with the different straight healthcare service providers and IT and medical sectors. Besides our products, we hope these products will also help to train the staff and to adapt using these products, and also include a 5-year warranty and maintenance costs. In 2019, we have received 2 rounds of application and grant about 140 million, involving 707 units, and to rent or procure over 2,900 technology products. The third round was closed on 27th of April this year, and we see there are 480 units applied involving 2,100 technology products. And also, in the trial scheme through the lottery fund, we allocate about 200 million for a 4-year pilot scheme to provide free Wi-Fi service at about 1,350 service units. And this scheme will roll out in January 2020. There are estimated to be 1,350 service units expected to benefit. That's the end of my introduction. And I welcome the members' question. Thank you, Assistant Director. Do any member have any questions? First, Mr. Xiu Kachin, followed by Mr. Joseph Lee. Let's allow 5 minutes per round now. According to the government response, as of 2019 December, there are over 900 elderly and PWD community care services and eligible for the gerontechnology fund. May I ask, Assistant Director, are mainly subvented or commercial services? The commercial residential homes are facing an acute manpower shortage and the lack of space. For the manpower shortage, we require the gerontechnology to help feeding and bathing. The lack of space would preclude, allow them to install such machines. For example, the wheelchair machine and feeding machine. On one hand, we have a shortage of calls for these machines, but however, the lack of space will really make unable to install them. So what's the position of the gerontechnology? We're helping the subvented residential homes or to helping enhance their services, or you want to improve the manpower deployment and service quality of the private nursing homes, and how do you deal with this conflict? The second question. So gerontechnology occupies a special niche. From what I found out from HKCSS or for the annual Gerontech Innovation Expo Summit, they also include soft meals. So those the water with coagulant, and because those elderly have swallowing difficulty, but for the soft meals provided by the private homes only provide something like a gruel and see that as elderly, which is bad for their digestive system. On the use of gerontechnology, would you consider have the across-the-board rollout of soft meals, or even a special therapist to resolve the swallowing problem? Allow me to respond first, and follow. I will have Mr. Chan to supplement on the services. Well, the target recipient were those who take part in the bot play scheme or in the subsidy scheme. So they have requirements on the manning ratio and the size. So that's why we see how the fund can be dispersed in this kind of premises. According to our records, we have more subvented organizations applying than those privately owned homes. However, we still have more applications coming. When it comes to gerontechnology, across different machines and different sizes, it very much depends. We need to see how the how the space would allow provide a reference list and allow them to try out these machines. For to see that whether the machines can provide a certain assistance in a residential home environment. So the HKCSS play a role in promoting the use of certain products, on advising the organizations on applying the right type of products or machines. So besides HKCSS, the sharing and exchange between different organizations, we hope to promote online exchanges as always to scout for more applicable technology. Mr. Chen, and the proportion of subvented and privately owned homes, where the elderly homes were only limited to bought places scheme, and only the day care unit and also the elderly center will also be eligible. So the proportion that the subvented organizations would definitely make up the bulk. As for the soft meals, in this latest budget, we have allocated about 70 million to provide resources for all the subvented RCHEs and the day rehab and outreach services in providing soft meals. So not all soft meals are in gruel form. We hope that we have enough nutrition and also have the money to make the soft meals that can really enjoy the joy of chewing. Because maybe due to various reasons, they may have some swallowing constraints. And since last year, we also have a speech therapist outreach to our subvented homes, and also this cross-disciplinary team, which contain a speech therapist to serve the elderly at nursing homes, which included the privately owned ones. However, they were all still run by our NGO partners. I would like to get some supplement figures. So what is the proportion of subvented and privately owned homes? You claim that there are more subvented homes. I just want to get the exact figures. I want to clarify that of the 70 million for soft meals, that will be for the whole, of both subvented and private owned homes. Well, we're only limited to our subvented services. Next, Mr. Joseph Lee.
Thank you, Chairman. Well, it sounds good as far as gerontechnology is concerned. As far as I know and through my contacts, and as an ordinary person, I have the feeling that it's a business. The government puts in a lot of money to promote the industry or the business, and people are sharing the booty. They make machines helping people to bathe or to walk up and down the stairs. Well, the elderly can fly. It's a business. Well, I'm not stopping people from making money or getting rich quick. Yet, those who will be benefited, well, I have not seen anything in terms of applying gerontechnology. And that is the responsibility for the government to promote the application of gerontechnology for caring. That's nothing new. Well, with regard to the use of gerontechnology for caring, whether it is the machines for the stairs or the bathing machine or soft meals, I think there are 4 objectives. The use of technology is to enhance the capability of physical capability of the elderly. The second is to help the elderly to continue their life skills. And the third is to preserve their cognitive ability. And the fourth is to maintain their social interaction. These are the core values of gerontechnology. You spend so much money on that, yet I have not seen these devices or equipment which will help to enhance these. As said by Mr. Xiu, there aren't enough manpower in the centers for the elderly. Can you hire more people to help out? I think what you now propose is just a drop in the bucket. You're just skimming the surface. Now you throw all the money out at the problems, but how can you achieve all these 4 objectives among the elderly? Nothing has been said in the paper on this. Well, there will be seminars in the universities. Well, in fact, there are good examples overseas. As a member of the academic community, I have some knowledge about this. I think, Chairman, it's very important. This is a good opportunity for us to discuss. It's not just about the application of gerontechnology. It's not just about method. It's not about the mechanical operation aspect. It's about making use of the technology to achieve the 4 objectives. And you have the responsibility to promote this. And well, of course, you must have the money to get people to apply and then make use of the technology. But then you also need to train people up to achieve the 4 objectives. How to enhance the physical capability of the elderly, how can they continue their life skills, how can they maintain their cognitive capability, and how can they maintain their social life. That's very important, and that will reduce the burden of the carers. Sorry, I have spoken too much on that, but nothing has been said about these in the paper. Mr. Kwok, or the 2 ADs, I thank the member for the view. From the start of design to application, we have not overlooked the use of technology, and we do assess whether the use of these technological products will help to enhance the objectives. So when an applying institution puts forward a plan, we will not just focus on the device or equipment. We want to see the outcome. So in the flow, in terms of the mode of delivery, we do assess each and every case to see if there is any improvement or progress, or whether there is further room for progress. We ask for 2 things. We asked HKCSS to continue with the educational efforts. We also asked the institution to open up their institution to let people to inspect how the quality of service is enhanced. We will work deeper in terms of quality, in terms of efficiency and effectiveness, and we hope we can they can share the experience. So in the approval process, we have not overlooked whether the objectives are achieved, and that is to enhance the quality of care. That's important to us. We will certainly consider these aspects in terms of applying such technological products. Mr. Chen. Thank you, Chairman. If I may add a little bit of on this. Dr. Lee's suggestions are also our concerns. We have only dealt with 2 batches of applications. Most are related, or most of the products are related to social interaction, cognitive ability, physical capability, living skills, and things like that. Let's take cognitive ability as an example. Some of the applications are related to stimulation of the cognitive ability of the elderly. The other about physical capability is about bathing machines and also machines for washing hair. I think they are interrelated. When there are such products, through our caring scheme, through our nurses training scheme, or through other induction schemes, we promote the use of these products. Without these products, then they really don't know what they are going to learn. With more institutions participating in the scheme, then the application of technology will become part of the whole process, and that will be dovetailed with the training of the carers. If I may add, the two officials have given very good answers. I'm glad to hear that, but I want to make a suggestion. Since your departments do attach importance, your department does attach importance to software or training, I want to emphasize that it's not just buying the machine and the machine helps you. You should also need to tell the institutions or the training institutions that in providing training, they have to make use of, they have to explain how these technology or technological products can enhance care. With regard to the 4 directions or 4 objectives, can they be achieved? Well, I thank the member for his advice. We will ask the institutions to conduct their assessment along those lines. Now, the HKCSS is doing some kind of educational sharing. In the future, whether it's in the expo or in the exhibitions, we will invite the institutions to display the achievements in terms of enhancement of quality of service, so that other institutions can learn from their experience. The scheme just started at the end of 2018. We'll go deeper, and we will do more in these areas. Ms. Elizabeth Quat. Thank you, Chairman. Of course, I support the promotion of gerontechnology. We hope that we can make good use of technology to solve the problems or difficulties in the area of care for the elderly. But the homes for the elderly are very small, and the carers face great difficulties. We really want to improve the living conditions of the elderly and also the care and also working conditions of the carers. As for home care, we also want to make use of technology to enhance home care service. I have talked to academics who are working on gerontechnology in the universities. I think localization is very important. Our own situation is different from other cities. We may be similar to those in Japan, but you cannot just copy directly from Japan. There's a need to go down the road of localization. Doing R&D is difficult. It's hard to find a suitable environment so that researchers can conduct research studies and also tests. I think the government should give more encouragement in this area. I have been to Yanchai. The centers for the homes for the elderly run by the Yanchai. They have make good use of gerontechnology, but there are many homes for the elderly in Hong Kong, and how many of them have made good use of gerontechnology and have successfully helped the carers and also enhance the quality of care? I've not seen significant achievements. Say, a bathing machine is bought and placed in a home for the elderly, then has it been put to good use? As for home care, I visited your gerontechnology expo. People buying very expensive machines. Is not that the machines are readily usable. You may have to do some alteration at home in order to make use of the machine. And how many people have homes big enough to do that? So there are missing links here and there. generally speaking, the direction is correct. From research and development to application, there is a lot of missing links and there is room for improvement. Promotion is not strong enough, and I hope more can be done. And response from the officials. It seems that is a point of view. Yes, thank you for the view. With regard to the application of technological products, sometimes products are rather simple, sometimes it's a whole system. Sometimes it's just a formula of care, and now we're talking about a pilot scheme or about tests or commissioning of new products. We want to make good use of innovation and technology and apply them to Hong Kong. The HKCSS plays a role in this. It works with R&D companies and institutions and try to find what is suitable for Hong Kong. Last year, we visited the expo in Hong Kong, and some producers made some products which could be used in Hong Kong. Some producers talked to local institutions on how to apply the products in Hong Kong. This is another area which we can work harder. We have started not a long time ago. We need to make further improvements in this area. Training, assessment are also important, and localization is also another aspect which is important. Some just hire a machine, some may just test the machine. They may not necessarily buy the machine, or they may not be required to buy the machine. We will try to make improvements and also make good use of the fund. Next, Mr. Leung Yiu Chung. Yes, thank you, Chairman. The two batches of approval are for buying machines, say, for example, the machine for scaling the stairs. And sometimes you can hire the machine, and you can also test use the machine. But would you encourage the institutions and the R&D institutions to work together so that the actual needs are tailor-made, the machines are tailor-made, instead of just putting the machine on trial? The machine may not be suitable, and that will be a waste if it is just trial use. So if it is tailor-made, it will be much better. So in your funding, will you be more flexible, say, invite a research institution to tailor-made a particular machine for the institutions? Can that be done?
Mr. Kwok, let me respond to Mr. Leung's suggestion. It's a very good idea, because I hope that the service unit will be able to make use of these machines. Well, as a bottom line, we hope to have a prototype of a product that have gone testing that proven to be safe or usable in the Hong Kong context. So at least you have this product in place first. But now that this trial scheme would also allow the R&D unit and the recipient to talking any adjustment and the design adaptation. So this trial scheme would hope to have some funding to allow them to tailor-make the features to adapt to the intended environment. So it had to be bespoke in a certain way. So we hope that this is a process, and learn from experience which would the best service model. Well, some of them can be turned on right away, and some of them will may lease for a few months and decide to trial another one. Well, in the long run, well, let's say when the homes undergo renovation or have a brand new residential home, that whether we can have a radical rethink. So we allow these service units to have to adapt or choosing the best machine. And for the mature products, like a certain kind of service unit, we see that as a routine in use. We may consider putting it in the projects under the lottery fund, so that turning it into the furniture of a product that they're open for application. So that's something we might consider in the long run. Well, to a certain extent, this bespoke concept would also be incorporated into our design. Well, I haven't checked out how the LC their homes actually use machines. I see that they have a lot of experiences. For example, the existing machines can be modified. So you claim that after the trial, you have this basis for you to refine it. So which would be the same effect of bespoke tailor-made? Because if you're not, well, you can actually modify the design to fulfill certain requirements. So you can encourage more residential homes to do that. You might necessarily have to buy the existing ones. Well, for the existing one, is some of the features aren't too applicable. You can actually appoint an organization to adapt the machine to suit your needs. So that is another way of tailor-made. So I would see that they're more relevant to the needs. If you can spell out in your funding conditions so that you let the service users know that such is allowed, that would be even better. Mr. Kwok, any response? Nothing further. Thank you, Mr. Leung's suggestion. Mrs. Siu Kachin, second round. For gerontechnology, to me, carry a key function. Really reduce the burden of the carers, as well the reduce the loss of the elderly bodily functions. And the HKCSS have this trial scheme to have this trial loan scheme at Shatin that allow the elderly to use this machine at home. The SWT considered the application of gerontechnology to be expanded to those waiting for a nursing home and the community care services, so that before they can wait their turn, they can reduce their deterioration and also take the pressure off the carers. Well, I don't know enough of gerontechnology. I see that most of it's applied on the service user. For the carers, well, the focus is more on the service user instead of the carer. Is that my misconception? Well, last meeting I mentioned that due to the epidemic, you can deploy the gerontechnology and technology to let those residents in the residential homes to stay in touch with their families. Can you cite more examples to illustrate how the gerontechnology can and also take care of the carers as well? I'll answer first to see Mr. Chan will supplement. Well, this gerontechnology fund, the original intention allowed a service unit to apply, but not the individuals. Well, that's how the system is designed. Well, it would tend to the machines, the product will help the service users, for example, in occupational therapy and well-being. As for the carers, well, maybe we'll also teach them how to use it, but not at home. We'll continue to deepen the service, for example, in the improving our integrated household services, and for those severe disability integrated home care services. So this product will actually enter their homes to let their family members know how they could use it to help. So for our door-to-door service, this house can be how door-to-door outreach or some that require use at the center. So the original design is not for the individual users, but allow the service units to enhance the quality of care. So that's the intention of the fund. We had no plans to expand it on a personal level. As for whether individual can master an equipment and other questions, are also a key consideration. Mr. Chan, Mr. Tan Tek Yi. Besides the residential homes, the elderly services read for a door-to-door service, or the day centers or the elderly center also benefit under the scheme. So based on that differential needs, they can procure different equipment and products. Like according to Mr. Xu, there's all waiting for RCHE places. There's quite a sizable population of them currently rely on the community outreach care program. Well, sometimes our workers will also help as well. Well, even the carers at home will also get help. For example, some organizations would could buy equipment and help their service users to swallow, which they could master on their own. On the proportion of the user and the carers are what the focus. So is there any equipment or product specifically targeting the carers? Well, for all this equipment, would definitely be user themselves, while this technology, about 80 or 90% of them would require someone using it. And a residential home environment, the carers will be mostly the staff. In the home or the center setting, there will also be a staff attending. Well, some of the carers, let's say family members, let's say they learn how to use it, we can provide some help. However, I really don't have figures on this. So I had this impression that this 1 billion Guaranteed Technologies Fund is really intended for the service user. As for the carers, the support to them, well, maybe that's not their focus. Okay, I would like to say a few words here. Well, including myself, Mr. Xu's office, Charles Mock in my office, and Mr. Yip Kin Yun. We have collaborated on this scheme and encouraging the students, secondary students, that visited elderly through teleconferencing, well, mostly subvented homes, some of them privately owned ones. Let's say some communication software, just so it is virtual visits. While implementing this scheme, that some disadvantaged homes doesn't even have the equipment. For example, well, some of them have a very small screen, or don't even have a laptop, and so they resort to tablets. And yet, the tablet is too old, do not able to support this new software like Zoom. Not only the equipment didn't work, the homes also have slow Wi-Fi speed to support the software and communication. Well, the carriers in this case had a role. Well, during the this epidemic, a lot of the homes did not allow family visits. If the center itself have such kind of tools and equipment, their family members, well, they could either stay in their home. I don't understand why they have to visit the residential home themselves. Well, in this case, the carriers can benefit. On one hand, we're allocating 1 billion, would disperse about 170 million, and there will be more disbursement down the road. That's not a small sum. However, when we implement a simple service, yet disadvantaged homes have difficulty in carrying the service. On one hand, we paint a very rosy picture. When it comes to reality, I believe it comes to a vastly different picture. And some of the technologies are locally researched and developed. For example, the e-diapers, which really have sensors in place when the bedridden elderly, if they have a need, let's say if the sensor detects a wetness in the diaper, they will start alerting the service desk, and so that the workers can replace the diapers as soon as possible. That's locally researched, and this has launched years ago. Well, 2 months later, the staff complained that they would quit if they insist on using these e-diapers, because it keep buzzing. So all the diapers were buzzing. They would have no time to attend to them. Well, nobody would notice if there are no sensors, but now that the sensors were buzzing all the time, they really stressed out the workers. To a certain point, the organization decided to drop it. On one hand, we have this very nice conceptual product, and the units willing to adopt them, but at the end, it proved to be unworkable.
And furthermore, many of these equipment need space. How many homes for the elderly are there? 700 odd. About several hundred are private homes. And many of these private homes are not in purpose-built buildings. Many are just in commercial buildings or residential buildings. Many are in the old buildings. They don't have enough space. They don't have enough passageways or wide enough corridors. But that's the same for the institutions for Pwds. As for the private homes, they do not have enough space. You have the whole setup. But the majority of the elderly living in these homes cannot enjoy the use of all these products, technological products. Is there any intention to or plan to improve the situation? Ms. Ng? Yes, thank you, Chairman. Mr. Siu and the Chairman referred to the emphasis of gerontechnology and whether it is only on the user rather than their carer. Is there in support of the carer? In our list, reference list of products, some of the products will help their carers. So, for example, electric bed. This will reduce the pressure on the carers when changing beds. And there are feeding machines which will help their carers or reduce the workload of carers. So the fund cares about the service users and also about their carers, and these products will help to alleviate the workload of the carers. As for the possibility that some of the institutions are not able to make good use of new softwares such as Zoom, with the tapering out of the epidemic, the institutions are beginning to allow or relax visits, but they do have preventive measures. Say only a visit by one person is allowed, and there are other prevention or preventive measures. But we will consider the use of technology to assist visiting. As for other matters, perhaps Mr. Chen can add. Yes, if I may add, concerning internet visits, so to speak, or cyber visits. There's a need to have Wi-Fi service, and therefore this year, starting from January this year, we provide subsidy to all the 1,300 odd service units, not just private homes. We provide free Wi-Fi service. It has started. Some homes may have some technical problems. Say, for example, that these homes may not be equipped with optical fiber or optical cables. When Wi-Fi is used for communication, if improvements can be made, then they can make use of the service. And in fact, we are rolling out the scheme on time. As for the application of the fund, private homes are not included in the scheme. For subsidized homes and board place homes in the board place scheme, they have limited space, and therefore when they buy products, they try to find products that suit the local situation. And there are products which adapt to the local situation. And not all machines are very big. Some sensory motor training machines are not very big, and also there are mobile systems, and they don't need a lot of space. Well, can you give us a list and also categorize those projects you have approved? There are thousands of products, 2,900 in the first batch, the second batch, 1,700. And in the third batch, there may also be thousands of products. What products are they? relatively bigger machines like a bathing machine, hair washing machine, or shampooing machine, how many machines have been approved and how many institutions have been approved. You need to categorize the products and the institutions so that we know how you've made use of the fund, what products have been bought, and what institutions have been benefited, whether this is used for the homes for the elderly or used for home care. Can you have a paper? Can you write a paper specifically for that? In 2019, we approved 2 batches, altogether 2,900 items. The third batch, we received 1,700 applications, and we are still assessing the application. We'll try to give you a breakdown on the classification of the products. I think it will be too cumbersome to list each and every item, but we can provide the categories or classification. As for the scope of application, that involves a lot of things and factors, and that may not be readily seen from an application form. But we do. We will be able to give you the classification of the products and also the classification of the institutions. Just now, Mr. Ng referred to the list, and there are many items which can reduce the burden on the carers. Now you have a list on the reference list, but does anybody buy that, and does anybody use that is another thing. Now you have relaxed the visiting restrictions, but we don't know whether there will be another wave of outbreak or epidemic. And we just cannot say that the epidemic has waned a bit, and we therefore visiting is allowed, and you don't need to explore the use of technology. You need to continue to explore the use of technology in this area. We need to make use of technology to help the chronically ill, the elderly, and also the carers for them. And some members have asked whether there's a chance to let this fund to help those who are cared at home. Just now, Mr. Chan, the AD responsible for caring for the elderly, said that there was such an application. Now, the machine belongs to the service unit, and will the service unit be put at the home of the service recipient? Now, will you let the service units to make an assessment if the service recipient and the family member have the need? Can they apply money for money from this fund and make use of the technology and product? Yes, if I may say a few words. Thank you, Chairman. As for the coverage of the fund, it is focused on the subvented institutions, and the elderly or the Pwds, whether they are at home or institutions, they will be benefited. Now we have closed the third round of applications. We believe that there will be more and more institutions making use of gerontechnology. We will be able to know the application the situation of applying gerontechnology. We'll assess the situation and consider whether we will adopt other means to help them. I hope you will have an open mind in respect of my suggestion. Now the equipment is there. Say, it is a home care service. Say, give a tablet to this service recipient. The tablet will help communication with the recipient, service recipient, but the tablet doesn't belong to the service recipient. It belongs to the unit, service unit, and if the tablet is taken away, then the communication stops. That is a digital gap, a yawning digital gap. Since there is the money, there is the fund, then would you allow the service units to conduct an assessment? And if there is a real need, can you make use of the fund, if there is flexibility, to assist the service user rather than requiring the service user to seek additional resources? Well, if there is no, if you don't allow that, then once once the machine is taken away, then by the service unit, then the recipients will not get any benefit. Right. Concerning gerontechnology, do members still have any follow-up questions? Well, if not, then we conclude our discussion on this agenda item. Thank you very much. Good. We'll move on to the provision of healthcare vouchers for Pwds. Let us invite the officials into the room.
For
this item, the Undersecretary for Food and Health, Dr. Choi, was supposed to come. However, he needs to attend a press conference. He hoped to return to LegCo after finishing his press conferences. So let's welcome the Deputy Secretary and also Dr. Frankie So, Consultant Doctor, Department of Health, and Ms. Elva Chung, Hospital Authority Chief Manager, and Mr. Kwok again from SWD. And for this item on the provision of healthcare support for PWD, we've invited the LWB, Labor Welfare Bureau, to attend as well. As to determine which department needs to attend, the LHB initially claimed that they are responsible for the elderly voucher scheme, and this PWD voucher might not be under the ambit, and the LWB claims that this PWD health voucher fall under the FHB. So that's quite baffling. So the healthcare voucher is currently managed by the FHB, Food and Health Bureau. However, they have not considered ever rolling out for PWD. So this item or this theme, we don't know which department we can talk to. Well, anyway, we invite both bureaus, and the LWB did not send a rep today, which I regretted. The needs of the PWD, the LWE should know better than other boroughs. As for the different kind of services to the elderly and the PWD, the LWB is the borough to go to. Unfortunately, they're unwilling to attend today. And for this item, on the support or voucher for PWDs, first we invite the administration to walk us through the paper. Ms. Yun. First, let's state that we have this elderly healthcare voucher scheme. Well, does that mean that this scheme is the equivalent of the PWD healthcare voucher scheme? Well, the document mentioned that we have no plans to roll out the voucher scheme for the PWD. Well, this proposed voucher scheme have no relationship with the current voucher system. As for our paper, we hope to introduce the existing medical services. For all Hong Kong citizens, including the PWDs, the government allocated huge resources providing appropriate service and support. Our public health system hope to ensure that everyone, including the PWDs, will not deny necessary healthcare services due to the lack of means. Well, besides getting medical attention like everyone else, as for those targeting the PWDs, which including for the special school students, that the free health checkup, as for eligible adult intellectually disabled or physically disabled students, and the preschool disabled children for the special oral care services, and also health education. And for under the government vaccination program, and also the government and for those under disability allowance and those intellectually disabled, and providing a subsidy for the seasonal influenza vaccine. And financial assistance to help those in need, including the PWDs, in getting appropriate medical attention. The Department of Health and the Hospital Authority have in place a medical fee waiver mechanism. And also the HA and the DCH have provided different financial assistance programs, including the Samaritan Fund and the Community Care Fund Medical Assistance Program, as also the specific programs for specified illnesses, and also through the social welfare programs to support the PWDs and provide different kind of allowances and subsidies and grants. The government have allocated resources on the medical and care services and financial assistance for PWDs, and the newly disabled, the elderly, also make use of the elderly healthcare voucher scheme for the effective use of medical. Just so considered, on one hand, we have to more specialized treatments and health services in order not to fragmentize, to complicate the subsidization mode. We have no plan to set up a dedicated healthcare vouchers for PWDs. We will continue to work through the existing mechanism to refine different arrangements. Thank you, Chairman. We're now open for the questions. First, Mr. Roy Kwong, 5 minutes. First, this proposed vouchers for the PWDs. Well, we don't know which bureau to attend. I know that it's not an operation issue, but as a policy direction, where to help the PWDs in providing vouchers for them. Well, the elderly had a better time with the vouchers, while the PWDs are the most disadvantaged. More recently, we talk about disability allowance. $1,835. We have the $5 increase this year. Besides this, what other support did they get? We'll have this really chicken feed. Well, it's disabled, let me chat with you. Let's say we'll provide healthcare vouchers for them. This is nothing new elsewhere. Well, maybe not in form of vouchers, but any kind of medical support. I'll be helping someone, a rare disease suffer. So he Well, gets a Samaritan Fund. However, he been through biologic treatment. The government claims that always ask them to go to Samaritan Fund, and Samaritan Fund claims that since the treatment is ineffective, we no longer apply approved funding. So should we let that person to die? I note that department, especially the civil servants, were not able to have their hands tied. We need to have a detailed research. We are sitting on trillion reserves. Well, how much does it cost for you undertake a study? How much would it cost estimate? Because the PWD are always disadvantaged. Because you wouldn't bother, you just tell them, and you have a lot of effective ways we have, and also I claim the Samaritan Fund and so on. If I digress, it will touch on the rare disease policy. So can we launch a trial scheme for the disability vouchers and assigning a certain bureau? We don't even know which bureau might be responsible. Let's say a policy bureau to pay pity. Well, is it according to the government claim is too broad, therefore they don't know how they formulate their policy. Well, you can launch a trial scheme, pilot scheme, allocating a quota, let's say maybe a few $1,000s, to let them see the doctor with that voucher, so at least show the government cares instead of this disability allowance just over $1,000. This is a new concept. Every time a new concept, there's also the old mechanism will claim the new idea doesn't work. We still should insist on pushing, because the government pushed the money on the over budget infrastructure. However, for the poor masses, it's really talk about on dollars and cents, and those being poor and sick. Imagine in their shoes. Let's say they're on disability allowance or CSSA, let's say a few $1,000s a month, and just renting a subdivided unit, and every day, they've been squatting in their 100 square meter or less. And for those wheelchair bound, those elderly, we need to take care of each other, and they're still yet to wait for their care allowance. As the chairman of the welfare panel, I can't criticize the capacity of the chairman. So thank you, the chairman, for bringing this joint subcommittee. So allow me to vent. So what's wrong with this kind of policy? Every plant had good intentions. I believe government representatives. I don't think this is not unfeasible. I note that in the current mechanism, you're not able to speak. Let's say take a step back. Let's say have a trial scheme on the disability voucher or undertake a study. Could any officer answer me instead of just talking through this? Ms. Yun, can we have a pilot scheme? Okay, thank you, Mr. Kwang's views. Well, let's talk about the objective of the elderly voucher. Encourage the elderly to use private primary health care providers. Besides the public health care, we also want to provide elderly with another option. If I'm not mistaken, according to Mr. Kwang, he sees that there's inadequate support for PWDs. Whether we should call it a voucher, well, we would deal with a different kind of questions. We want to help the elderly to see the doctor they're most used to, so they would not need to visit the public hospital often, which would be more convenient. That was our intent. And like Mr. Kwang said, there's the current amount is allowance insufficient to deal with this. We doubt that whether we need to come with another voucher. Well, that's the various perspective. I try not to interrupt Ms. Yun. Well, take a further step back, come have a new scheme. Well, what's wrong with actually having a voucher scheme? Well, nobody dared to say that the government support of PWDs is adequate. Of course not. Otherwise, it will be blasted by the PWD groups. What a lot of, it comes to mind of any, let's say, rare disease sufferers and so on, or those who are wheelchair bound. The government support to them was minuscule. That's why we need to come up with different ways. And now that you can do vouchers one way, do we have another way to support them? Well, you don't even have much to speak of. That's why I'm talking with, if the elderly voucher take the pressure off their public health care system. I just went to a repeat visit today for my neck. It took forever. While the public hospital working very hard, we have the HA staff, we know they're having a hard time. And for the healthcare vouchers, see they enhanced the elderly voucher system. Just the recipient changed to PWDs below 65. While a lot of them become disabled when they're 20-something, while a lot of them are forced to live in the RCHE because they're worried their carers are not able to cope with them. Well, what support do they get? Not much. Well, for disability allowance, you know that you have to fulfill a lot of conditions. And for the disability voucher, allow them to stay in the community, according to Ms. Yun, just to see the doctor we're used to. Well, it's about 2 billion maybe? They're roughly all right. Why can't we do that? Let's say you're right that the elderly voucher was allowed the elderly to visit the doctors to know. Why not we have a trial scheme? You can do it under the community care fund to see if we can regularize it. Or what other factors? Or let's say you can't differentiate or who is disabled, and you have to have a position. Otherwise, you can't enlist our help or assign the we're responsible. Gives a reason. Besides claiming this is the elderly voucher have a different intention, so why not the voucher for PWDs? Public officers? Ms. Yun? Well, our paper explained what were different services provided for PWDs, whether for HA or DH, and also some limits, especially for them. And for the social welfare department, also have this disability allowance. As we are providing support in different form, that's why I don't see, does it mean it's enough? I'm not dealing with this question. There are different ways. Well, what a healthcare voucher is different from subsidy. While the voucher themselves, from our design, didn't really look at the income levels or even target the health of the elderly. And to develop the primary health care, well, we decided to target the elderly because we see demographic changes, such they have its own unique context. We have no plans to launch different kind of vouchers. We just want to see our subsidy policy become fragmentized and complicated. While looking at PWDs, we know that there are quite a lot different kind of support. Of course, Mr. Kwong screamed that this is not enough. Well, from the voucher administrator POV, so why can't we have some concrete improvements? Well, can you cite some examples?
Whether it's the SWD or HA or the DH, they provide service. Say, for example, dental service. In recent years, we have had new schemes. We do not see there is any special need to have another system of voucher. And the healthcare voucher has its own management system. And also service users who can have vouchers, and also service providers, so on and so forth. But that's rather general. But different PWDs have different needs, and whether a voucher or a healthcare voucher is a suitable tool, from our point of view, from our experience of handling elderly healthcare voucher, we don't support having a separate healthcare voucher for the PWDs. At the start, let me say a word. At the start, I said it was not your responsibility. It was the responsibility of the Policy Bureau their response is weak. Now, if you say you can't solve the problem by that, then conduct a survey, conduct a pilot scheme, and if it fails, then take it out. You've tried, you have the data. Ask them. Say, for example, I give you $1,000 or $500 per month, a few $100s, just to give it a go. Try it out. If you can't answer me today, well, your answer is just very weak. Now, there are PWDs. They do not get any support from you. $1,800 and you add just a few tens of dollars this year. I don't want to make life difficult for you, but go back and then start a survey. You get that data. You have registration of PWDs. Ask them if there's a healthcare service, a healthcare voucher for you. Will they accept that? Yes, you better do a study instead of just saying that you don't see that there is a need. At least you look into that, can you? We have no plan to look into that. As for the improvement of healthcare voucher, we are looking into that and how to make good use of the elderly healthcare voucher. Different people have different demands on us and asking us to do different things. As for the healthcare voucher, last year we did a review on how to improve the elderly. They trust the public healthcare system. They make use of the healthcare voucher for cure, for medical treatment. Can that be spent on prevention? We really want to make some improvements on such areas. Well, theoretically speaking, we can look into many things, but I have to tell you seriously that we have many other things which we want to do first in terms of healthcare service. They're really recalcitrant. Mr. Leung Yu-chung. Well, I have to declare interest because I am a beneficiary of healthcare voucher. It is very convenient. I can go to a TCM practitioner. And I like visiting TCM practitioners. Well, healthcare voucher is very convenient. I can go to the physicians I prefer anywhere in Hong Kong. I think there are two objectives of having the healthcare voucher. First is to relieve the burden on public healthcare sector so that the elderly people or some elderly people can have an alternative apart from using the public health care system. Secondly, it also facilitates the elderly in choosing their preferred physicians who may be near within their community. As for the PWDs, they even need that convenience. For example, I'm really mobile. I can even walk up to the Princess Margaret Hospital from Kwai Fong. But the PWDs cannot. Many of the PWDs have difficulties in getting public health care service. Most of the hospitals are in remote places. They may be high up the hill slopes. They may be far, far away. And it's even dangerous for the PWDs to go there. They need to be assisted. They need somebody to assist them. But if the PWDs are given a healthcare system, given a healthcare voucher, then they can go to the physicians on their own with their walking sticks. As for the elderly, not 7 out of 10 have to be assisted by walking sticks. Say, I don't need a walking stick, but 9.5 out of 10 require somebody to assist them when they go to the hospitals. So why can't you give them the healthcare vouchers? That will bring relief to the public sector, healthcare sector. The Pwds need more attention. So that, in fact, fits very well with your objective. So why don't you think about it? Well, if you are an able-bodied person, you really don't need any assistance. But if you are a PWD, then you will find it very difficult to get public healthcare service. You have to queue for a long time, and you have to take public transport, which is not very convenient in terms of bringing you to the hospitals. Why can't you deal with that by the voucher? Well, Ms. Yun, I'll answer the question first, and then Dr. Choi will supplement or will answer as well. As for the PWDs, they are given the disability allowance. I'm sorry, it's not about money. We understand that the elderly people also have CSSA. They have free healthcare service. Let's don't talk about money. I understand that. It's about additional resources, which is provided by the healthcare vouchers. And that is healthcare within the community, and that relieves the public sector, healthcare sector. Well, healthcare voucher is about money because we need to pay for that. As for the PWDs, they'll have more money to decide on what they're going to use, how they're going to use the money. Different people have different needs. And what we are doing is to provide the service and improve the service. Say, for example, dental service. The healthcare voucher is just a means of payment. And our view is that the healthcare voucher is for the elderly people only. Well, she is just reciting the official answer. That does not address the question. You need public funds for the healthcare voucher. Now the money goes to the private physicians. It looks like you have to get additional resources. But if they go to the physicians in the private sector through the use of healthcare voucher, then they don't need to make use of the public sector healthcare service. And you spend money on one side, and then you have savings on the other side. So you need public funds for public healthcare service as well. So there are two main points. First, if you give a medical voucher, healthcare voucher, that will give relief to the public sector healthcare service. And secondly, it will convenience the healthcare, the elderly. By the same token, it convenience the PWDs. 9.5 out of 10 PWDs require somebody to assist them when they go to public sector healthcare service. It's really inconvenient. And that's a fact. You don't answer my question. You're just reciting the official answer or the standard answer. I think the PWDs have greater need for the voucher. Now, to directly answer the issue, well, if I give them money, that will facilitate them. The question is how to pay them, the means of payments. It's not about additional resources. We need an additional system. We need another framework, another scheme. Is there really a need? Yes, there is the need. I'm talking about the need for another framework, another system to deal with things that we are already dealing with through other means. Now, the healthcare system, healthcare voucher has its own system. At present, it is only for the elderly only. As for the Pwds, we don't say that they have no need. It's just that their needs may not be dealt with by the healthcare voucher. In fact, the administrative system of the healthcare voucher is rather complicated. There are already different channels providing service to the Pwds. Why can't that be improved? Now, Ms. Yun, if I may follow up. Now, you give several reasons. Number one, different types of services are given to the Pwds. And there are also different types of services and cash assistance given to the elderly. Whether there is more cash subsidy to the elderly or more cash support to the Pwds, it's more likely that the elderly will have more cash support for daycare centers. There is no such kind of service for the Pwds. As for non-means tested cash allowances, there is OAA for the elderly, and then there is DA for the Pwds. If it's free service, free medical service for the elderly, CSSA recipients, that's the same for elderly. For the elderly, that's the same for the Pwds who are DA recipients. There are different types of support given to the elderly, and yet you still give the healthcare voucher to the elderly. One of the reasons is to relieve the burden on the public healthcare sector. But in fact, it cannot be achieved. Many elderly people are chronically ill. They are chronic patients. You give them the healthcare vouchers. If the chronic debilitations are followed up by the private sector physicians, then you can relieve the burden on public healthcare sector. But the elderly are not doing that. They only use the healthcare voucher for occasional illness, such as a common cold. But for their chronic illness, they go back to the public healthcare sector to do the follow-up, to receive the follow-up treatment. This is a fact. They don't go to the private physicians and making use of the healthcare voucher to do follow-up treatment for their chronic illness. So you cannot take away the burden on the public healthcare sector by making use of the healthcare voucher. You only help the elderly in terms of treating their occasional illness. And that's a piece of good work. Why can't you do that for the Pwds? The Pwds also have chronic illness. And if there is any occasional illness, then they can be cared for within the community by making use of the healthcare voucher. Their situation or their health care will not deteriorate, and if their health deteriorate, then they will become an added burden to the public healthcare system. I don't know whether Ms. Yun has all the data or she just turned her eyes away, turned a blind eye on the need for service. In fact, both the healthcare, both the elderly persons and the Pwds are groups who need long-term care. And if you help them with the healthcare voucher, that's just natural.
I wonder if the Undersecretary would like to respond. Thank you, Chairman. As of using the healthcare voucher to deal with a medical problem, maybe earlier in the meeting we have give you the background. Well, for the elderly healthcare voucher, we found that in the status quo and in the first 10 years, the first initial goals, some of them are still not fulfilled. For example, like allowing the elderly to choose their own doctor so as to rely less on the HA system. While the CUHK have conducted a review a few years ago, we found that we have more people using both private and public. Well, there'll be a lot of factors explaining this. For those with chronic illness and with their incidental the sudden needs, occasional medical needs, well, a lot of people, for example, like women, children, cancer. So at this stage, when the whole elderly healthcare voucher regime, now that we had finished a review a few years ago, for example, the disbursement amount or the administration, the working with limit certain category, put a cap on certain kind of providers. So this kind of administrative adjustment was implemented a year ago. We had a holistic review. At this stage, is not the right time to have another kind of system played. On the other hand, I agree with member. So for those with physical disability, well, for any kind of services, not just the public health care, also came across obstacles, in example, transportation, and also a chaperone. For HA, whether for the outpatient or day clinic or home visits or patient transportation and other kind of support, they managed to try to come up with ways with the patient and for the carers whether we can provide more ancillary support. I suppose there'll be definitely room for improvement for existing measures. I believe they go in parallel. I think Mr. Leung mentioned, let's say, PWD compared to pediatrics and the women, that the mobility is impaired. Well, if you have a healthcare voucher, allow them to get the medical services nearby, to get a prompt Medicare, that would make a difference. I hope that you can keep an open mind in this subject. Well, some other organizations have conducted a study, and the Fu Hong Society have also conducted a survey with thousands of respondents, and they found that the medical expenditure is quite significant. So, a study was quite 7 years ago. The Hong Kong Rehab Society, well, on average, each PWD individual, it's about $2,000 per month. And the disability allowance back then was just about $1,000. So let's say the DA wasn't able to fully cover the medical expenses. I'm talking about the average here. So what is the current situation? Let's say vouchers may be redundant or unhelpful. I think we need to keep an open mind and should attempt to understand, instead of just claiming they already have other kind of support that is necessary. I'd like to give Mr. Xu a bit more time. As for the government refusal to roll out vouchers for the PWDs, I think while the government officers have cited the reasons set in the paper, you're claiming that the resource consideration and while the PWDs require more specialized treatments and healthcare services, and in order to avoid fragmentization and complication of the standard subsidy mode. So whenever resource is mentioned, well, just the same thinking for primary healthcare. The WD should have more choices for disease prevention. In the long run, it would only reduce the medical resources. Well, the primary healthcare, as compared to the residential care, would give you an alternative thinking. And you're claiming the PWD requires specialized treatment. Well, they're humans too. Besides specialized treatment, they will also have the general medical healthcare needs. Well, I'm a diabetic and also a heart disease. Of course, I'm entitled to my specialized treatment. Well, I will also have a flu and fever, etc. Like Dr. Chang said, when we talk about complicating the subsidy mode, the elderly voucher have been launched for years. Well, you have a basis and a mechanism for reference already. As for the government refusal, I'm quite disappointed. The government is still adopting a very tunnel-eyed a therapy-based approach to a PWD health voucher, besides debating the merits of this proposal. Well, a question for the government. When the government is promoting primary health care, have you taken into account the general healthcare needs of the PWDs? How do you cater for their disease risks? For example, how do you take care of the adult intellectually disabled in the context of primary health care? Dr. Choi. Okay, thank you, Chairman, and Mr. Shields' question. And for primary health care, at different generations, the government attempt to conduct a review or refinement or some planning. For this term administration, no exception. Well, as this involves a lot of stakeholders, well, one key focus of this current administration, besides reviewing the reliance on the aid departments, can we have a platform for different demographics for the health management for the first or second layer prevention or risk assessment or changing living habits? And also member also understood, especially for those with PWD. Well, their mobility is impaired and also wheelchair bound. Or for example, exercise, well, they will have less options, and for a healthy diet, they would have more concerns. From launch the district health center, well, to promote chronic illness management, it's really preliminary exploration, and the process will incorporate elements in requiring the DHC operators to cater to different needs. I believe that the PWDs upon our review that will be incorporated into requirements. And for those intellectually disabled or physically disabled, besides their own disability, their decision-making capability and also self-care abilities would rely on the carers. For the SWD or other departments, providing a support for the carers, whether financially or providing training. I believe they have planning in place. I believe that will continue to attach importance to. Mr. Xu mentioned, for example, on the preventive and for primary health care, for the elderly, they have this at Elderly Health Center. Well, in Hong Kong, all 18 districts, whereas none for the Pwds. Now that you have set up the DHCs, and yet they're really open for everyone. Well, it's mainly for the prevention and the chronically ill. I believe that this topic would allow the Pwds to receive better primary health care. Well, now that the elderly voucher scheme not too effective at the primary health care level, which you already undertook a review, if you take the Pwds into account, that would be perfectly reasonable. While the needs for long-term care are relatively similar, so instead of overhauling the mechanism, I appeal to you so you can also consider the Pwds. I agree with Mr. Xu that how complicated could it be? I don't think it's not to the extent that you're not able to roll out. And for how do you determine DWDs? You already have the existing mechanism in place. As for the service provider, they already have the system in place to accept the vouchers. I couldn't see any difference that would prevent you from rolling out. As for the transport concessions, well, the Pwds and the elderly are currently eligible for this as well. So I hope you can give it some serious thought. Now that everyone in LegCo had a consensus that CS is a key concern area, I agree that the Pwds have different needs. While the Pwd by comparison with the elderly daycare center, but yet they're not specialized facility for the Pwd rehabs. While this keeps evolving, while 2 or 3 decades ago, while the elderly day hospital was borrowed from the UK, back then it was limited to elderly. Well, however, we noticed that, for example, the stroke victims may be in their 40s, and yet they're not old enough. Well, at a very early stage, we had to refuse them due to age constraint. However, HA noticed that, TBDs could be young in age. For example, those with aneurysm or stroke or those with bone fracture, they may not be all elderly. So over the years, we start to accept the younger patients as the target users.
I just want to explain that there is really the need. But as for the means and also the tools, there are many channels to provide service to the PWDs. Well, I just want to make one more point of observation. Now, concerning the ambulatory care service at the hospitals, there is an improvement. There is no age limit. But the services provided by the SWD, say, for example, elderly daycare center, you need to be 60 or above before you are eligible. If you are less than 60 years old, if you have long-term care needs, you need daycare service or daycare follow-up, then there is no similar service like the elderly daycare centers. Now, there is a daycare or community support center for the PWDs, but they are not for the frail PWDs or the daycare training centers. If you are 16, you're eligible until you die. There may be some who are frail. They may be so weak that the service cannot help that PWD. Then that PWD will have to be institutionalized. If there is not enough daycare service, and if his healthcare needs are not attended to very soon, then that will lead to more institutionalization of the PWDs. Now, community care, daycare will help to keep the PWDs in the community and live in the community for a longer period of time. When it comes to the stage that their carer, be they parents, if they are parents, they may be too old to care for the PWD, then the PWD will have to be institutionalized. Anyways, staying at home with one's family members is the best. So I hope that you will consider from different angles the ways and means to help the PWDs so that they can maintain or even enhance their quality of life, instead of just putting them into institutions. Dr. Choi, you know that the PWDs are waiting for a place in an institution for more than a decade. They have been waiting for more than a decade in order to get a place in the institution. We really want to help them so that they can stay in the community longer. Yes, Mr. Kwok. Just now, Dr. Chui said that we do have community rehabilitation centers, and they are linked with the hospitals. When the PWDs are discharged from hospitals, then we provide service to them in the community. Say, for example, a stroke patient. We provide training to them so that they can live in the community. That's a dovetailed service between the hospital and the welfare and the community center. In the post address and also in the latest rehab program, we have made a suggestion. We're going to launch 2 new centers. They are similar to the modus operandi of the elderly daycare centers. These 2 new centers are center-oriented, combined with home care service. The 2 working together will help to enhance care. They may not need to bring the PWD to the center for training and then bring the PWD back home. We make use of technology, and we also put emphasis on community care, say OTPT, speech therapy or care training, and also there is support for the carers. We hope that the PWD will stay in the community. There will be 2 such centers in the pilot scheme, and we work according to this mode of service. We hope that some services can be targeted towards extending the PWDs staying in the community. Our care for the PWDs are now spread out in among different service units. This enables the provision of service in different districts and in different aspects, but we need to help the Pwds to continue to live in the community. We want to delay their time for institutionalization. We want to provide support to their carers. So we will have a pilot scheme for 2 centers and to gather experience, see if we can develop it further. Yes, thank you, Mr. Kwok. That's what we want to hear. We have been asking for that. We have been asking for this because it is a missing link. The issue before us today is the healthcare voucher. And the healthcare voucher is to meet occasional healthcare needs. We hope that there can be immediate response to occasional healthcare needs. Now, the elderly healthcare vouchers have been there for many years, and we hope that a similar service can be provided for the Pwds. But it's a pity that in the paper and also in today's exchange, there is no indication that the administration is thinking along this line. Being representatives of the people, we want to express their views, and we see that this provision of service will be a support to the Pwds, and it is not very costly. Comparatively speaking, it will not be a very big additional financial commitment, and I hope that you will reconsider that in the future. Good. We end our discussion here. Thank you very much.